Yes, with HIV, yes, the person can look healthy. There's this balance. They say that HIV no they show for face. It actually doesn't show if it is at the level of HIV. But there are different clinical staging, WHO clinical staging of the disease. We have stage 1 to 4. From stage 3 to 4, those are the 8 defining stage. And during the 8 defining stage, we see that there might be some physical appearance that you might see in the person that will make you know that, oh, this person is not okay. Some of the physical appearances, the person looks wasted. You see them really looking lean. Those were the case in those years when HIV was newly discovered. I think we should do some part of the history of HIV. I remember from literatures that we read, the first case we had in Nigeria was in 1986, and it was found in a 13-year-old girl, a female sex worker, 13-year-old, a teenager. Yes, and it was in this population that I earlier mentioned about, the key population, because she was said to be into transactional sex business. So then they were not giving them the terminology of female sex worker. So yes, that's the history of HIV. And in those days, they see people on the road, they pick them up on the road, because most of the patients because there were no interventions, most of the patients usually would get to the 8th defining stage. So they are wasted, some of the symptoms you see even in the early stage of HIV, yes, they might look healthy. However, there are some symptoms that it will show up with, but those symptoms are typical of any other infection, like malaria, like typhoid, like flu. Or some people will say they had was just a rash, and it's pointing them to the fact that there's something wrong. Because what happens in the infection is that when the HIV gets into the body, it attaches itself to the CD4. There's something we call the CD4 cells. They are like soldiers, in Latin. The helper cells, the T helper cells in the body, they are the ones fighting infection. The way God has actually created us, we have the ability to fight whatever comes into the body, as long as the body picks it up. However, when the T helper cells are overwhelmed, that's when we might need to go to the hospital and take drugs to help it heal well. So what HIV does is that when it enters the body, it targets that T helper cells, the CD4, and it attacks it and depletes it. It fights the CD4 cell. They are like two soldiers fighting now, HIV soldier, and they are supposed to fight off any form of infection. It's there. Even for malaria, the CD4 cells are there to fight. But when it becomes they are overwhelmed by the virus, maybe the quantity of the pathogen in the body is more than the soldiers. But what HIV does specifically is it not only targets it targets to kill the CD4 cells, and it continually depletes the CD4 cells until the HIV virus will take over the whole system. So when a patient is newly diagnosed, the key test we tell them to do is the CD4 count. We want to know how many the count of the CD4 cells left in the body as at the time of inception, and then we monitor, because we expect that the CD4 should increase as the patient continues on treatment. And then when the HIV is in the body, after killing off the CD4 cells, it depletes, and the viral load will continue to increase. So it's like a reverse thing. The CD4 cells are reducing the viral load of the HIV wave until it takes over the entire body. And at the point where it is taking over the body, that is when we get to the WHO clinical staging of 3 and 4, where they are 8 defining. And at that stage, without treatment, the patient might not be able to live for more than months, just few months. Yes, but the patient HIV and AIDS. So the simple difference: HIV is the early stage of the infection. HIV infection, that's the early stage of the infection. AIDS is the later stage of the infection. Like I earlier mentioned that we have the WHO clinical staging. So stage 1 and 2 can be said to be HIV infection. At that point, you might not really come down with anything physical to tell the person or anyone around you that you're living with the infection. However, your body will give you signals. The problem with us in this part of the world is we wait until things are so bad. The likely symptoms at the earlier stage of the early infection, that's between the first month of infection, like I said earlier on, it's just the normal flu-like symptoms. Just having a cough, having a catarrh, having a simple rash on the body, having a headache, just like the malaria-like symptoms. Those are the normal symptoms, that we see. So it's important that when we go to the clinic, especially when you know what you have done, because the truth is we like to live in denial in this part of the world. You've had an unprotected sex and you're going to the clinic to tell the doctor that, oh, I just have this. You didn't mention that, because if that client had actually mentioned, oh, I had unprotected sex, I don't know the status of my of my partner, the doctor might have recommended that, oh, let's have this investigation done, let's have HIV tests done. But our people love to live in denial. The things have gone out of hands, and that's when. So the early part of the early stage of the infection just the flu-like symptoms, it's what some people might not even see anything. It depends on how powerful the immune system of that person is. You know, a lot of things affect our immunity. The daily stress we go through, or the kind of food, the quality of food we eat, you know. So our immune system varies from person to person. So, but for the later stage, you will see fever, you will see rash, very serious rash. I remember those days when I was in state hospital, we'll see patients that the first thing that made them know it was HIV, they'll come to the hospital and tell us that one saw and one lapped. There's a Steven Johnson-like rash on their body called after in today or off hour. I don't know the difference, but I hear it a lot. You know, so when you see anybody to upon someone latter, please let the person go for HIV infection, because at that stage it's usually you see that kind of rash, you see severe and chronic diarrhea, where the patient will just be stooling, has taken all the flagyls and all the antibiotics, it's not working, just watery stool. Then sometimes you see some warts, genital warts, oral warts, or what's it called now? Thrush, oral thrush. You see the tongue of the patient whitish, or even vaginal thrush. People that are always treating toilet infection, they should check for HIV.